again, sun has a big part to play in this as well. Okay, so there are a couple of premises that I really like to emphasize. This has always been my mantra, and I actually saw this online. I was like, hey, this is kind of cool. What this is, you know, everyone knows it. Remember going back to, you know, elementary school and everything, they used to teach you the food pyramids and what there's Maslow's hierarchy of needs and all those psychological terms and all those psychological things. Well, this was kind of like the topical medication or topical cosmeceuticals on how to make yourself look better. All right. First and foremost, sun protection. Okay. Second, retinoids. What are retinoids? Retin-A. Okay. It's been shown, and as a point of disclaimer, I trained at Penn, and Al Kligman from Penn actually had the patent on Retin-A. So obviously, I was a big fan and favor, but they showed that in these like 35 to 40-year-old women who had some acne that were being treated with Retin-A, that their fine lines and wrinkles were going away. So actually they got in there and they did the studies, and they actually were able to prove, and that's why almost in every over-the-counter type of thing that talks about anti-aging, there's probably some retinol in there. Retinol or retinoid, which is just retinol and retinoid are all derivatives of vitamin A, by the way. Okay? So it's all vitamin A type of based.
Is that not to be confused with benzoyl peroxide then?
Correct, yeah. Benzoyl peroxide is completely different. Retinols, retin-A's, tranitoin is the generic. So a long-term use of a retinoid is very, very beneficial for improvement. I actually saw a patient about 2 weeks ago that had been on Retin-A for like 20 years. She was 50, I tell you, she looked great. And she had no fillers, no lasers, nothing like that, just sunscreen and Retin-A, and she looked fabulous.
Prescription Retin-A?
Yeah.
Nothing over the counter?
You know, that's a huge debate, and certainly the Retin-A that's prescription is way more effective. When you look at the derivatives, the retinols over the counters, those type of things are much less potent. They're not bad, they still work, but it takes much longer time frame in order for it to have any sort of an effect. So yeah, I mean, you know, talk to your dermatologist, or you know, if you don't have one, you can certainly come see me. But I'm a huge fan of the retinoids in prevention of skin cancer, as well as you know, the fine lines and wrinkles, because it actually has been shown to kind of help for skin cancer prevention as well. All right. There's vitamin A antioxidants, that's more topicals, and you can do some other things. This was just a topical regimen as far as anti-aging, more so than the full face. Remember, what was the very first thing I said? When you look at the skin, you gotta think 3D, right? Not just 2D. So there's other things that need to be taken into considerations. And this is the bony type of things that I was telling you about. So what they did was they did 3D reconstructions of a CT scan, okay? And then this is a young female, an old female. You can just take a look at the angle of the jaw is much less, the density of the bone, the sagging of the orbital rim, kind of right from there, it's kind of sagging there. The frontal bone as well kind of sags. So a normal physiologic response, a normal aging process is losing all of that stuff. So how do we kind of slow down the appearance of some of these things? So because this is natural, you cannot really fix this. I mean, topicals, you can certainly use Retin-A and sunscreen and doing lasers and all those kind of things, but really for this, it takes, again, that 3D type of concept that we'll be getting into. All right, but to start with, the one thing that's kind of been popularized that everyone kind of knows about the Botox parties. There's many different types out there. There's the Dysport, the Xeamins. There's many other different players on the block right now, but certainly the name recognition of Botox is relevant. And what does Botox do? Well, it kind of goes after the muscles. You can see above, you can see the lines, the vertical lines right there. Also locations is the forehead, kind of have the horizontal lines, and if you really squint, you kind of have the radiating lines out from the eyes, okay? These are all locations where muscles are creating the appearance of wrinkles, okay? And certainly the skin has a part to play, but that compared to this. But in my opinion, this is my opinion, I do not like the Joan Rivers look, all right? I am not a fan of the Joan Rivers. Only when people literally beg me do I sincerely give that frozen look. Even to the point, like if you really look at some of the tricks of the trade, for instance, is that, I don't want to give up too many secrets now, is that, especially for news anchors, because you need to have expression. It's actually from a medical perspective. If you're a doctor and I go up to you and you're like this all the time, is he mad? Did he get enough sleep? You know, what's going on? It's been shown actually in studies that people who have that frozen Botox look face, that people think that they're more angry and that they're not as expressive and that they're kind of cold from a psychological standpoint. Okay? So my practice is I like to be very subtle, even to the point of injecting more frequently to give that more of a subtle look than the frozen type of look. Okay? I like to have a little movement, you know, a little movement in through here. Sometimes if people want it frozen, then I'll say, well, how about I freeze you here and just do a little bit in through here so you still have some expression here in your eyes. And then next time, we'll freeze you here and then do less here and give you a little bit more expression in your forehead. Kind of alternate so that you still don't look like you're a meanie-weenie. Okay? What we're going after is the muscles here. And I'm going to show you a series of pictures here where we kind of talk about the ramifications of looking at the muscles and their activity on our skin and the way our skin appears. Okay, this is the majority where most people get Botox. Okay, you know, there, the various muscles that through there, kind of up on the frontal area, up here on the forehead. Those are the locations where most people kind of get the Botox to kind of help minimize the amount of lift. Right? And this is kind of a before and after. Kind of looks nice and smooth, you know, very clean. It does. It looks, the one, I really liked it, and I think that they did a very good job, and I think that she still had some movement as well. The problem is that sometimes, you know, knowing where to go and where not to go, because you can almost get like the Spock look if you freeze things too much here, then the eyebrow over here kind of just lifts up, and you kind of look like Spock there a little bit. So the Spock guys, you know, you need to kind of do some things to kind of counteract the Spock guy type of thing. But this is a nice clean look in my opinion. So, someone who's a handsome guy, you know, has some nice, you know, crow's feet as we call them right there. A little Botox in those locations will kind of help smooth that out and make it look less so. But sometimes that's good. You know, maybe he wants to have that. Maybe I bet you he had Botox. If he just has that, the crow's feet, I bet you he had some Botox right through here. And that's what I'm talking about. You can do one and maybe not the other, still so you have that amount of expression. Bunny lines. Little lines right there in the nose. Okay, it's one of the areas that's overlooked. It's kind of nice and very subtle. That can be improved. I like to do some areas around the eyes as well to kind of help with some of the wrinkling that can occur out and through up underneath the eye as well. See? The lips. It's a very common location as well. So, you know, certainly for those who are smokers in the past, this is a big time issue. And so this is something that, you know, you kind of, we ended up treating. And, you know, it's kind of a very subtle approach, but it's something that can smooth things out. Gummy smile. I mean, these are some types of things that we can use the Botox for. Okay, the gummy smile to kind of inject right up through there, and you can see the drop there in that top lip from the gums down to the top of the teeth. Okay. Underarms, so sweating. Okay, some people are big time sweaters. Okay, and Botox is highly effective for that. Okay. The problem is that a lot of insurances, actually doctors lose a significant amount of money if they do Botox for sweating. So most doctors don't do it because the insurance companies do not reimburse for that for the most part. But it's highly effective, even to the point with our wounded warriors that I treat, their prosthetics, you know, for the amputees, they sweat. Normal sweat collects up underneath their prosthetics, and because of the neoprene sleeves and everything like that. So we pretty much go in there and remove all the hair, and we Botox their leg, which is really painful. But then their sleeve fits much better, and they don't have to pull off their sleeve to release all the sweat. So it's highly effective, and if you are a big sweater, it's something that can be done as well.
How long does that last?
It depends on, it's really directly related to the amount. So I'll give you an example. When I was in Vegas, this was more of a pain in my rear than a service that I was providing. So I would do like 100 units per arm, and then it would last a year. Most people and most insurances that do pay just do about 50 and 50 because the bottle comes in 100, so they just use one bottle, and so they separate it out. But that really only lasts about 6 months. So if you do it, I recommend, obviously in San Antonio, probably this year, you could delay that a little bit because we had such a wonderful spring. But most of the time in March or April, I have them inject, so that way it lasts until like September timeframe. So that way they get this summer relief. And that way they don't have to do it 1 year, even if they have to pay for out of pocket. Okay. Yes?
I actually had that recommended to me for my right side. I didn't do it because it was cost prohibitive. I was put on Teflon curls to begin with, but it dried me out too much.
Yeah.
So I need sinus relief. What I did was I cut down to 1 cup of coffee in the morning, and no problems. It was, I guess, caffeine related. Have you heard of
Well,
that?
certainly there are enormous number of triggers, stress, and there's a significant, but I have surgeons come in, I had one guy, and literally he would have to change his shirt after every single case because of the fact that he would just literally sweat down all over to the bottom. It was embarrassing because he was an instructor as well, and so all the residents would kind of, is he stressing out too much? And so it was very, very stressful for him, and so it was a big time issue. But this is very effective, and certainly there are some medications and multiple other triggers as well. But yeah, that doesn't surprise me at all. Okay. So to go back to the volume. Okay, when you hear about fillers, who's heard of fillers before? Have you heard of what fillers are? It's kind of like Restylans and things to where you actually inject medicines down into your skin, down into deep layers. Actually, go to the next picture. Down deep into the skin to restore some of that volume loss, okay? Because we lose muscle structure, we lose fat structures, and we actually lose bony structures, right? So it all kind of diminishes the volume. And if you look at, someone who's, 70 or 80, they have, some hollowing down through here, their face is kind of sunken in, things are kind of sunken in a number of different locations. So what you can actually do is use these medications to kind of go in there and reestablish a sense of volume that's been lost, okay? My favorite location is to kind of do it right up underneath the eye because of that hollowing. Again, physicians, people, they'll come up to you, sweetie, you need to get some sleep, and it happens, and they come in, they're like, everyone always thinks I'm tired, and it's very, people become self-conscious about that at times. And so it's something that really can be fixed. Actually, I've had it.
How long do fillers last?
What's that?
Fillers. How long do they last?
It's a good question. Everyone is a little bit different, okay? Some last, most of them will last more than at least 6 months, okay? There are some that last 3 to 5 years. And fat is used as well, where they kind of nicely do liposuction and inject the fat, and so that's, yeah, so that's actually one of the things that, yeah, it's recycling. So it's very green around here. But, the fat is sometimes falling out of favor because it's so easy to use some of these medications. It's kind of garnered a little bit more support because 3 to 5 years. The fat, honestly, in my opinion, in my experience, lasts about the same amount, maybe a little bit more. But if you're going to get liposuction anyway, it's kind of a nice little thing to kind of consider.